Hi, I'm Nicole Aaronson. I'm a pediatric otolaryngologist, and today I'm going to talk to you about how to prepare your child for surgery. So surgery is a very stressful thing both for parents and for their children. If you have a young 13 to 16 month old getting ear tubes, there's not a lot to prepare them besides trying to keep them comfortable and distract them while they're unable to eat. But if you have an older child, it is important to prepare them. I think for most people, adults and children alike, there's a significant fear of the unknown. And so the more you can tell your child what to expect from their appointment, the better the day will go. And so when I counsel my patients, I sort of talk them through the day when they get to surgery, what they can expect, how they'll fall asleep. I don't generally focus as much on what's going to happen while they're asleep. I usually say something like, while you're asleep, I'll take care of everything I need to do, and because that part is less relevant for them. But I tell them what to expect in the pre-op area, how to expect to fall asleep, and what to expect when they wake up. I think the biggest mistake parents can make is trying to fib about either the day itself or the recovery. So when a patient asks me, will I have a sore throat after my tonsils come out, I always tell them that they will have a bad sore throat and that it will go away, and that the most important thing they can do is to keep drinking to keep themselves hydrated. But I never tell them that they won't have a sore throat, because I think it's really important that both the parent and the provider are able to maintain that trust with the patient, that they know that the parent and the provider are going to be straight with them and that they can rely on the information that they're given. I also think a big mistake is to try to hide from the child that they're having surgery. I know that there are a lot of children out there who have a lot of anxiety, and often parents will think they're sparing them by protecting them from knowing about the surgery, but children are generally very smart. They tend to be listening even when they're playing on their iPads or don't seem to be listening, and so they generally figure it out. I had a girl who was 12 years old whose mom told her the day of her surgery that she was just coming for an exam. She insisted that we do the consent paperwork out in the hallway so the child wouldn't hear. Now the child sort of had picked up on some of the clues. She had seen me in the office. She was now seeing me upstairs. I was wearing a different outfit. I was in scrubs. I had my hair covered. And so there were a lot of things that didn't look to her as a 12-year-old girl like a typical doctor's appointment, but she didn't say anything. And then we rolled back into the room, and just before she was about to breathe the candy smelling air and go to sleep, she said, wait just 1 minute, I want to let you all know that I know I'm having surgery today, and I've always known that. And she really just wanted to go on record and let us know that she knew her mom had lied to her, and she knew we had all helped participate in the fraud. And so I felt really bad that she felt deceived as a patient. So I think the most important thing with kids is to be upfront and to sometimes say, I know you don't want to do this, but it's okay, and this is why we have to do it, and mommy and daddy make the rules, and they're doing this because this is what's best for you. I also think it's okay if a child is scared that they cry. If I see a patient who I can see is holding in their tears and trying to be brave, sometimes I say it's okay, you can let it out and you can cry, because I think it's okay for them to be nervous. Nervous is normal. I always tell them that while I've done this many times, this is new to them, and that's okay that they feel scared. I don't think it's fair to ask them to fake their emotions, but I think it's important to always be honest and upfront and give them as much knowledge as possible. So my big tips in preparing your child for surgery is just to be honest, to answer any questions as thoroughly as possible. If you're not sure how a process works, reach out to the doctor or the doctor's office to get more information, because the more you can familiarize your child with what's about to happen, the more comfortable they'll be and the more comfortable you'll be. Thank you so much for listening. If you'd like to see more of these videos, please subscribe to Dr. Nicole Knows.